Welcome to the deep dive. Today we're tackling some source material that, honestly, it's quite alarming. It focuses on what seems to be an ideological crisis brewing within medicine itself. Our conversation today is really centered around a critical essay by Hélio Angotti Neto. And this essay, it was sparked by a really controversial article, one published in a well-known medical ethics journal.
That's right. The original piece by Jubilini and Minerva, that's what set off this intense critique. They argue for something they actually call after-birth abortion.
After-birth abortion.
Yeah, and our source, Angotti Neto's essay, immediately flags that term, says it's a precise but pretty chilling euphemism for infanticide.
The critique does say, look, these kinds of arguments maybe aren't entirely new in ethics history, but what's different now, it argues, is the, let's say, refinement they're presented with.
Right.
And crucially, how they're being applied to challenge the very core of the medical establishment. The shock, the source uses the word espanto, isn't just the idea itself, but that it's being discussed like it's neutral science.
Exactly. So our mission today, it's a bit tricky. We're not here to jump into the moral debate head on, take sides. Instead, we need to act more like, forensic analysts. We have to really dig deep, do a meticulous deep dive into the philosophical gears turning here.
The mechanisms, yeah.
The language tricks.
Yeah.
The logical steps these authors use to try and justify such a, really radical shift in medical practice, and even how we think about the value of early human life. We're dissecting the intellectual moves they're making.
And it seems like the first move is all about language.
It absolutely starts there.
So let's unpack this linguistic strategy. Because the critique argues this whole debate hinges on manipulating the words we use, using euphemisms deliberately to, soften concepts that are deeply repulsive. That seems to be the main tactic.
Yeah, it's like a rhetorical shield, isn't it? Designed to block that gut reaction, that undesired emotional impact. Our source gives a pretty clear definition. A euphemism is softened language used to avoid repulsion or, unwanted impact.
Like the example it gives.
Right. The difference between saying someone suffered a grave accident versus laying it out. They were run over, head crushed, brain dead, waiting for organ donation.
Wow.
One phrase lets you keep your distance. The other just forces you to confront the brutal reality.
And the central euphemism, the really powerful one in that controversial article, is after-birth abortion. It feels like an attempt to take this act, killing a newborn child, and kind of sneak it under the umbrella of abortion, which is legally, and for many culturally, more accepted.
That's precisely it. The name itself is doing the work, trying to borrow the moral status of the fetus, before birth.
And the critique points out the authors were really careful not to use the word infanticide.
Oh, rigorously avoided it, yeah. Instead, the source says they use this whole list, a kind of catalog of phrases, all designed to describe, killing a baby, but in these very clinical or philosophical terms.
Like what were some of them?
Well, you see things like euthanasia in children, which sounds medical, or actively terminating the life of a child, again, sounds procedural.
Clinical.
Then there's preventing someone from becoming an actual person, which is more philosophical. And that really loaded one, killing a potential person in the newborn stage.
The sheer number of these and how carefully worded they are, it suggests this wasn't just casual phrasing, it feels like a calculated strategy, right? Ideological language, really working hard to desensitize people.
Absolutely calculated. And the critique brings in some powerful historical context here. It mentions the psychiatrist Juice Meerloo.
Ah, okay.
Meerloo, he lived through World War II, studied totalitarian methods, how language controls thought. And he had this really chilling observation. He said, "He who dictates and formulates the phrases and words we use is the master of the spirit."
Wow, master of the spirit.
Yeah. By engineering the terms, these authors try to manage our moral pushback, shift how society sees it. They want the discussion to be about the concept, this abstract after-birth abortion, not the concrete reality of infanticide.
And it's not just this issue, right? The critique mentions other medical phrases that kind of mask harsh realities. It feels like a pattern.
It's presented as a systemic tool, yeah.
Yeah.
Like involuntary active euthanasia.
Okay, what does that really mean?
Well, strip away the technical jargon, and it just means killing a patient without their consent.
Right.
It always seems to be about swapping moral clarity for technical-sounding complexity when there's a specific ideological goal in mind. Creates distance.
It creates distance, yeah. But the critique then tries to pull it back to earth, right? Back to the concrete reality. It talks about this reality gap between abortion and infanticide.
That's a really effective counterargument in the source. It argues that forcing this term after-birth abortion deliberately ignores some really crucial physical, anatomical, and just practical differences. Differences that make the two acts fundamentally distinct, even if the outcome, death, is the same.
I found that part of the source really impactful, kind of forces you to visualize the facts. What were those key differences the critique highlighted?
Well, the physical ones are obvious, right?
Mhm.
Abortion happens inside the womb, infanticide happens outside.
Okay.
And the risk to the mother, that's drastically different. The physical risk of delivery, that's over for the newborn. The psychological risk of the decision, well, that remains, of course.
And the methods used?
Completely different instruments.
Oh,
Abortion involves suction or extraction tools
yeah.
after birth. Well, it's whatever method is used to cause death.
Mm.
And that, the source points out, opens a really disturbing door, questions about, vivisection or other horrific possibilities.
But the most striking difference, the one that really seems to cut through the euphemism, is how the child responds.
Exactly. That's the core of it. A fetus reacts, sure, but often you only see that on an ultrasound.
Right.
A newborn, though, it reacts with a visible cry, a scream, physical struggle. It's immediate, concrete, you can see it.
Mhm.
A fully formed human being fighting to survive. And that reality is precisely what the term after-birth abortion seems designed to just erase from our minds, erase it from the doctor's mind, the public's mind.
So the language aims to make you think only about the fetus's debated moral status and ignore the undeniable physical reality of the born child. Why? Why is that evasion needed?
The critique suggests it's necessary because that born life needs to be, well, instrumentalized. It needs to be treated as a variable, not a given.
That clarifies the mechanism, yeah. Once you weaken the language, you can start questioning the value itself. It lets the philosophical argument move forward by treating life not as inherently valuable, but as something quantifiable.
And that leads straight into the next part of the critique.
Moving from the language games to eroding the actual value of life. The critique looks at how these arguments relativize life, first through economics and then through hedonism.
Right. Because traditionally, in the West anyway, life's value was seen as foundational, either rooted in, say, the Christian idea of being made in God's image, or in the secular framework of universal human rights, inherent dignity.
An objective value.
An objective intrinsic value. And that's exactly what the economic argument tries to pick apart.
Mm.
The moment you start putting numbers on life, quantifying it, you abstract it. It stops being about inherent quality and becomes a cost-benefit analysis.
We hear this kind of utilitarian calculus a lot, don't we? The argument against spending, huge sums, tens, hundreds of thousands to keep someone alive in an ICU if their prognosis is poor.
Mm-hmm.
They argue those resources could be used more rationally, save dozens of kids with simpler, cheaper problems.
The source critique calls this the horrifying logic of permutability.
Permutability.
Yeah, the idea that a human life has a price tag, basically.
Yeah.
That it can be rationally traded, swapped out, permuted for money, or even for a statistically larger number of other lives. It's pure, unchecked utilitarianism, the greatest good for the greatest number applied ruthlessly to healthcare budgets, suggesting some lives have to be sacrificed for the collective.
The kind of cold intellectual detachment you'd need to frame it purely as an economic equation, that almost feels more alarming than the conclusion they reach.
It is alarming. And the source uses that example, the statistical argument, linking legalized abortion to a supposed drop in crime decades later, to show where this logic leads.
Yeah, I remember reading about that connection being made. How does the critique analyze that?
It presents it as a really devastating example of using statistics to justify something awful. The critique points to research that essentially calculated the cost, if you can call it that, of about 30 aborted lives as being worth it to prevent one hypothetical future murder.
30 lives for one potential crime prevented.
Yeah. And the critique just slams the profound asymmetry and injustice in that calculation.
It feels like the ultimate weaponization of potentiality against the vulnerable.
Absolutely. You're justifying sacrificing, say, 29 or 30 definite innocent lives, now the innocent babies, as the source puts it, for the purely hypothetical prevention of a future crime by someone who might not have even existed or might not have become a criminal.
The asymmetry is stark.
It really is. The present sacrifice is certain. The future benefit is probabilistic, hypothetical. And the critique adds, it often rests on this really ugly premise that statistically the poor or marginalized are more likely to become criminals, so eliminating them preemptively is somehow justifiable.
That's the ultimate instrumentalization of life, isn't it? If you can calculate a statistical benefit to eliminating a group, their lives stop being inherently valuable. They just become a resource, or worse, a liability to manage.
Precisely. And that leads right into the second way value gets relativized, the hedonistic argument.
Okay, so this is about pleasure and pain.
Essentially, yeah.
Yeah.
The argument that a life without pleasure, a life defined by pain or unavoidable suffering, just lacks meaning or value. Because in this view, the only thing that makes existence worthwhile is pure enjoyment.
So if a life is deemed inevitably painful,
It's deemed unworthy of continuing. End of story.
which is a complete turnaround from how suffering has often been viewed historically and globally, as a source of growth or meaning or empathy.
It's a radical break, absolutely.
Yeah.
The critique pushes back hard on this. It says suffering isn't just bad in some abstract sense. It can have immense value, teaching resilience, forcing us to think, and crucially, moving other people to compassion to charity.
Right.
The idea that total pleasure or comfort is the only measure of a worthwhile life, the critique portrays that as dangerously simplistic, reductive. And this hedonistic idea sets the stage for the controversial article's core philosophy. If preventing suffering is the highest good, then preventing potential suffering, even through death, becomes justified, regardless of who that person is or could be.
Okay, so now we get to the real engine of the argument, right? The philosophical lever they use to decide who gets the right to life and who doesn't.
Exactly. The controversial article's main point, its thesis, is that after-birth abortion should be allowed if it prevents a burden. And this applies whether the newborn is severely disabled or, critically, even if they're perfectly healthy but just unwanted.
That's a huge claim. How do they justify that scope?
It all comes down to this actual versus potential dichotomy. It borrows concepts from Aristotle, actually, but twists them in this life-denying way.
Aristotle, how does he fit in?
Well, Aristotle talked about potentiality, what something could become, and actus, actuality, what it is right now.
Okay.
The controversial authors grab onto this. They argue that both the fetus and the newborn are merely potential persons. Neither one, they claim, is a person in a morally relevant sense.
So neither has a right to life yet, in their view. How do they define person to exclude a newborn human? That seems like the key move.
It is the key move. They define person very narrowly. A person is a subject entitled to have the moral right to life. And to qualify, you need the ability to form goals, appreciate your own existence, and attach value to it.
That's a pretty high bar, cognitively.
Extremely high. And by setting it there, they can argue quite clearly that newborns just don't meet the definition. They lack that developed self-awareness, that goal-setting capacity. They even suggest some sophisticated animals might qualify, or some humans with intellectual disabilities might, but a typical healthy newborn, nope.
Wow. Okay. And this definition then leads straight to what the source critique calls the prejudice criterion. This sounds like the logical linchpin that justifies the killing.
It really is the engine, yeah. The controversial article claims that for any subject to have a right, like the right to life, a necessary condition is that they must be prejudiced if they're deprived of it.
Prejudiced, meaning harmed or disadvantaged.
Kind of. More specifically, it means you have to be able to realize or feel that you've lost something valuable, that your goals or desires have been thwarted. If you don't realize what you've lost, they argue you haven't lost anything in a morally significant way.
The application of that to a newborn seems chillingly straightforward.
It is. Because a newborn hasn't formed goals or objectives yet, killing them doesn't stop any future plans they were consciously pursuing. It doesn't cause them emotional loss that they can appreciate.
Right.
Therefore, within this specific framework, no prejudice is done to the newborn by ending its life.
Yeah.
And if there's no prejudice, there's no harm. And if there's no harm, then no right to life has been violated.
But the critique slams this, calls it a non sequitur, which, for listeners, that's a basic logical fallacy, right? The conclusion just doesn't follow from the starting point.
Exactly, a logical leap that doesn't connect.
So why does the critique say no prejudice means no right? Is flawed logic.
The source counters that rights aren't based on the recipient's capacity to feel the loss or understand the prejudice. Rights are based on duties.
Duties.
Yeah. The right to life exists because others have a duty to respect that life. It's not dependent on the person whose life it is being able to, recognize or mourn that their right was taken away. The duty exists independently.
The critique uses some strong examples to break this down, doesn't it? Like the lottery ticket analogy.
That's a great illustration they use.
Yeah.
Imagine someone wins the lottery, a huge prize, but before they even know they've won, a thief steals the winning ticket.
Okay.
The victim has no idea what they've lost. They feel no prejudice in the sense of thwarted expectations.
Yeah.
Yet, have they been harmed? Absolutely. Have they been prejudiced, deprived of what was rightfully theirs? Of course. Their lack of awareness doesn't erase the objective loss or the wrong done by the thief.
That makes sense. And the critique takes it further, saying if this no prejudice means no right rule were actually true, the whole idea of human rights would just collapse into pure subjectivity.
It really would.
Yeah.
The source even throws out this provocative hypothetical. If the only thing that counts as harm is frustrating someone's conscious goals, what about a psychopath whose goal is to murder someone for pleasure?
Okay.
If you stop that psychopath, according to this twisted prejudice logic, you're actually prejudicing them. You're thwarting their right to pursue their chosen objective of pleasure. It just elevates subjective desire over objective reality and creates a kind of moral free-for-all.
And this ties back to the idea of identity, right? The critique insists that trying to deny that a newborn is the same person they will be later is just denying reality.
Yes, it argues that personal identity is continuous. You're the same entity as a fetus, a newborn, a child, an adult. Your biological identity persists even as your cognitive abilities change. So saying a newborn isn't a person in every stage of development is dismissed as illogical, just a way to avoid the implications.
And there's an inconsistency in how they use potential, isn't there?
A crucial one the critique points out. The controversial authors are happy to use potential negative outcomes, potential suffering, potential social burden as reasons to justify killing. Future negative potential matters morally to them.
Right.
But then they turn around and deny any moral weight or value to the child's positive potential, the potential to become a fully developed person with goals and self-awareness. It seems like they're selectively choosing which potential counts, based only on whether it supports their conclusion.
Okay, so we've seen the language strategy and the philosophical framework. Now, how does this abstract stuff translate into actual policy? The source brings up the Groningen Protocol in the Netherlands.
Right, the Groningen Protocol is the real-world example. It's the Dutch protocol that actually permits the active termination of life for some severely ill newborns. It shows how this relativized view of life gets formalized into rules.
What are the rules? What does the protocol require?
It lays out 5 main criteria. First, you need certainty about the diagnosis and the prognosis. Second, there has to be unbearable and hopeless suffering. Third, an independent doctor has to confirm the first 2 points. Fourth, the parents must consent. And fifth, the procedure has to be done according to acceptable medical standards.
On the surface, those sound pretty strict, like they're trying to limit it to extreme cases.
They sound strict, yeah. But the critique argues there are deep fundamental problems with how subjective and, frankly, unworkable some of these criteria are.
Like which ones?
Well, unbearable suffering is a huge point of contention. Who gets to define that for a nonverbal infant? How can you objectively say a baby's suffering is both unbearable and hopeless?
Good question.
The source even asks, if the suffering was truly unbearable and hopeless in a medical sense, wouldn't it likely be fatal on its own fairly quickly? Yet we know some babies under this protocol have lived for months. How can that suffering be deemed insupportable if the child continues to live? It seems to rely heavily on adult interpretation and projection.
And the requirement for medical certainty about the prognosis, that seems like a really high bar for doctors. Is certainty even possible in medicine?
That's exactly the critique's point. Achieving absolute certainty in prognosis is incredibly difficult, if not impossible. The source relates it back to basic medical statistics, test sensitivity, and specificity.
Right, how accurate tests are.
Yeah, sensitivity is how well a test catches a condition when it's there. Specificity is how well it rules it out when it's not there. No test, no prognostic model is ever 100% certain. So basing a decision to end a life on an inherently imperfect assessment, where even a tiny error rate is catastrophic, the source views that as incredibly dangerous. Unacceptable, really.
Okay, then there's another policy point that critique highlights that I found just astonishing. The way the controversial article dismisses adoption as an alternative, even for healthy, unwanted babies.
Yeah, that part is stark.
Why? Why dismiss adoption?
This is where that philosophical idea that the newborn's interests are basically zero really hits hard. The controversial authors argued that giving a child up for adoption might actually cause the biological mother more psychological distress than if the child were killed.
More distress than killing the child. How?
They apparently cited reports of mothers grieving the loss after adoption, or always wondering, dreaming their child might come back one day.
But surely the adoption system itself could be improved to support mothers better. Is the critique suggesting the authors just took the path of least psychological resistance for the adult?
That's exactly what the critique argues, and it seems fair based on the logic presented. The controversial argument literally says, since a potential person's interests are zero, remember the prejudice criterion, the psychological comfort of the actual person, the mother, takes precedence.
Wow.
The source calls this the ultimate instrumentalization of the child for adult convenience. It points out how easily the well-being of the family could be declared at risk in almost any birth if you use a subjective standard of stress or burden.
Stepping back a bit, the critique connects these policy ideas to bigger ideological currents, right? Like social engineering. It mentions the journal editor, Julian Savulescu, and links him to ideas about eugenics and transhumanism.
Yes, it draws that connection. Savulescu's work often touches on themes of human enhancement, improving humanity through technology. The critique sees this fitting into a pattern it calls the temporal inversion of revolutionary thinking.
Temporal inversion, what does that mean?
Instead of the present gradually shaping a better future, it's like a hypothetical, perfected future society. Maybe one streamlined by getting rid of burdensome individuals is used to justify actions, potentially murderous actions, right now in the present.
So the ends justify the means, but the end is a future utopia.
Something like that. And in this vision, the physician's role changes dramatically. Not a healer focused on the individual patient, but an instrument of social selection, someone deciding who fits the blueprint for the future and who's a liability.
The source material also talks about the reaction to the original controversial article. Apparently there was a huge public backlash.
Oh yeah, immediate and visceral. And the way the editor, Savulescu, responded is quite revealing, according to the critique.
How did he respond?
He basically framed the public's repulsion, their shock and disgust, as just being opposition to liberal values, called it fanaticism.
So dismissing the public's moral intuition as bigotry or ignorance.
Pretty much.
Oh.
But the critique pushes back strongly against that dismissal. It argues this reaction isn't fanaticism. It's the good sense, the basic moral compass of ordinary people who are shocked to see acts they consider horrific being presented as if they're just neutral scientific options. It's a clash between this cold, rationalized ideology and that fundamental human gut feeling against killing the vulnerable, an instinct that, has arguably underpinned civilization.
And this whole conflict, from the language games to the policy proposals, the critique sees it culminating in an attack on the ultimate symbol of medical ethics, the Hippocratic Oath.
Yes, it frames the whole debate as an incremental assault on the oath, or, as the source puts it, a mutilation of the oath.
Mutilation. Strong word. How so?
Well, historically, the oath did more than just say, do no harm. It set specific boundaries that defined what a physician was and wasn't. It explicitly forbade 3 key life-ending actions.
Okay, what were they?
First, giving deadly drugs to cause or hasten death. Second, practicing abortion. And third, performing surgery that was left to specialized surgeons back then. This triad, the critique argues, drew the ethical line. It separated the true physician from, say, the executioner, the poisoner, or just the quack offering quick fixes.
But modern versions of the oath are different, aren't they?
Very different. The source points out that many modern versions, especially those used in medical schools, including in Brazil, where the critique originates, have systematically cut out these specific prohibitions. They've amputated or just omitted the clauses about abortion and assisted death.
So the core argument isn't about the literal wording, like sacrificing to Greek gods.
No, exactly. The critique stresses the value is symbolic and principled. We don't worry about the pagan gods part. The oath's lasting importance was in establishing core principles. Non-maleficence, do no harm, beneficence, act for the patient's good, confidentiality, and crucially, treating all patients, rich or poor, free or slave back then, with dignity.
Right.
When you surgically remove the specific clauses defending life at its beginning and end, the critique argues, you hollow out the core principle that the physician's primary role is to be a relentless defender of life.
That distinction, the source makes the oath separating the physician from the executioner, that feels really critical.
It is critical. The moment a doctor accepts the role of deciding who lives and who dies based on criteria other than pure medical need or the patient's expressed will, the argument goes they fundamentally step away from being a healer and life advocate. They become something else.
And that's the danger the source sees.
That's the ultimate danger identified. If the medical profession starts routinely adopting policies like Groningen, or philosophically accepts that a patient's life value is negotiable based on costs, or others' comfort, or quality of life projections, well, the profession risks just becoming another institution swayed by politics, or budgets, or eugenic fads. The vocation of healing gets replaced by the function of social management.
It sounds like an existential choice for medicine. Stick with the traditional values, care, dignity, defending life, or embrace this new role as a kind of neutral technician implementing social goals.
That is the core conflict laid bare by the critique. And it concludes with this really powerful warning. Unless doctors remember their fundamental vocation, their calling, they risk becoming terrible judges, handing out life and death based on spreadsheets and subjective guesses instead of the inherent objective dignity of every human being. Hashtag tech outro. It's
Well, this deep dive has certainly uncovered what feels like a profound ideological struggle. Foundational philosophical ideas seem to be getting twisted, often through careful language, to justify actions that historically were just unthinkable within medicine. The danger that Angotti Neto's critique points to seems really clear. It's the systematic replacement of core medical values, inherent dignity, the duty to defend life with criteria that feel arbitrary, subjective, instrumental. Things like economic cost or psychological comfort for others, or these very technical, narrow definitions of what counts as a person.
It really is a shift away from recognizing the objective reality of the human being, a reality that, biologically at least, is continuous from conception to death.
Yeah.
A shift towards a much more subjective, calculated reality where value isn't inherent, it's assigned. And the ultimate danger the source identifies is this idea of medicine being sequestered, basically hijacked, to become a tool for social engineering, which transforms the doctor from a healer into this terrible judge, as the source puts it, objective less in a way, just carrying out calculations.
And if we take that central premise from the controversial article seriously, that the right to life hinges only on having already formed goals and being able to appreciate your own existence,
Right.
the implications, as the critique warns, they definitely don't stop with newborns.
Absolutely not. If society starts accepting this idea that value is arbitrary, assigned based only on current measurable abilities rather than inherent identity, what raises a really chilling, provocative question for you, the listener, to consider.
Which is,
Who's next? Which other group in society might be deemed non-persons by those in power or by the supposedly rational elite because they don't meet some cognitive or economic benchmark?
Yeah.
The severely disabled, the terminally ill, the elderly with dementia, maybe just the economically unproductive.
It definitely raises the stakes.
It raises the stakes far beyond just the medical field. This kind of ideological crisis, the source suggests, strikes at the very foundation of how we protect vulnerable human life and civilization itself.